co-author, Arvinth Kupusamy, who's here with us today, and our supervisor, Dr. Somsubhra. So, during one of our ward rounds, we came across this patient who has a very rare disease. So what disease is this? This is a primary malignant melanoma of the cervix with distant metastasis to the liver and lungs. So without further ado, let's dive right in. Let me introduce to my patient. In loving memory of my patient, in our patient, Mrs. X, a 68-year-old woman who presented to us with postmenopausal bleeding and also abdominal pain for 1 month. She also had associated symptoms of loss of weight and loss of appetite for also 1 month. So we then further ventured we further ventured with a speculum examination, and in this speculum examination we were not surprised to find out a large cervical mass extending from the cervix to the lower 1/3 of the vagina. We then, as you can see in figure 1, this is a transvaginal ultrasound that we have performed, and it shows a mass of 3 centimeters times 3 centimeters dimension in the endometrium. So look at figure 2, doctors. You can see that it's a CSCT of the pelvic, thorax and abdomen, showing a large cervical mass with regional lymph node involvement. And this is where it proves and confirms the distant metastasis. As you can see in figure 3A, it shows a liver metastasis, and also in figure 3B, extensive lung metastasis. Now, we did a histological examination, and histological examination revealed a lot of extensive infiltration of the cancerous the tumor cells, and also melanin pigment were present. Now, as I further go down to immunostaining, revealing 3 important and crucial protein markers that will confirm the diagnosis of our patient. So what are those markers? S100, HMB45, and Vimentin. Doctors and ladies and gentlemen, please keep in mind that S100 protein marker is very sensitive. HMB45, on the other hand, is very specific. The combination and positivity of these two will clinch the diagnosis of malignant melanoma of the cervix. So with this, we then had a discussion whether this was primary or whether this was secondary. So me and Arvinth did a lot of literature review and a lot of research, and we came up with a criteria of Norris and Taylor's, not Chuck Norris, but Norris and Taylor's. And the criteria in them suggested that 3 out of 4 criteria were present in our patient. Sadly, there are no consensual gold standard treatment for patients suffering from this rare disease because of lacking of randomized controlled trial. So because of this, there is no proof what is best for our patient. Because our patient was in stage 4B, we started our patient on IV dacarbazine, 2 cycles. And after 2 cycles, we wanted to initiate the 3rd cycle. Our patient, sadly, she passed away on December 2017, 6 months after our initial diagnosis was made on July 2017. So therefore, in memory of Mrs. X, I hope her case was well justified by us. Thank you, everyone.
Thank you. Can you go to the top of the poster, which you missed at the beginning, so we can see what the top looks like and who was involved? That's good. Thank you.
Thank you, doctor.
Thank you very much for your presentation. My question is, she came in, was she seen by any primary care doctors before?
Thank you for your question, doctor. According to her, when we met her, she said that she denied that. When she came, she presented to us with these complaints without any history of primary care contact.
Okay, my second question is, she was diagnosed in July, right? And when did you decide to give the chemotherapy treatment?
The first cycle of chemotherapy was given in October, the second was given in November, and the third was scheduled in December, but she passed away in December 2017.
So, a quick question on how you phrased the. Well, maybe you can explain it a bit further. You said about yourself and Arvinth came up with a criteria. Okay. So can you just maybe say that in a couple of sentences again on how you applied a criteria to this? You don't have to give me the whole spiel or give us. Just give me how that played into your paper.
Thank you, Doctor. Basically, what we did is, because we had to differentiate between primary and secondary malignant melanoma of the cervix, because there are these two that exist. So there's a criteria called Tyler and Norris. So based on these criteria, there's 4 criteria. Our patient fulfilled 3 out of the 4 criteria. Therefore, putting it into a primary group, not secondary malignant melanoma of the cervix. It's primary malignant melanoma. We didn't come up with any. Thank you, everyone.